everyone! I hope you're all doing well and are safe. Welcome back to the next episode of Cancer Behind the Scenes as presented by Cancer Together. In today's video, we'll be learning about immunotherapy. Here's just a short reminder. Make sure to check the official Cancer Together website for any updated information on this series, to watch our YouTube videos when they drop, and to play the educational Kahoot game to help retain the information in a fun, interactive way. Before we get into any new content, let's just revisit the previous video and recap briefly. So before, as we've mentioned, we've been talking about each form of treatment in their own exclusive videos, and in our last video particularly, we talked about targeted therapy and what exactly it is, how it works, different types, and the different side effects a patient can have. And now, we'll be moving on to our next and final treatment of discussion that is far less widely used, immunotherapy. So let's talk a bit about what immunotherapy is and what it does. Sometimes, cancer is able to avoid being found and destroyed by the immune system, and because of this, immunotherapy was developed. Immunotherapy is a form of biological therapy, which means that it uses substances made from living things to treat cancer, and it can help the immune system fight off cancer. And when it is found that the immune system is responding to the tumors, tumor-infiltrating lymphocytes, or TILs for short, can be found in and around these tumors. Continuing on, there are of course a few different types of immunotherapy. These include immune checkpoint inhibitors, T-cell transfer therapy, monoclonal antibodies, immune system modulators, and treatment vaccines. Immune checkpoint inhibitors are drugs working to block immune checkpoints to allow immunocytes to respond more strongly to cancer. T-cell transfer therapy works by taking the most active immune cells the body has and multiplying them so that the natural ability of the T cells to fight cancer is boosted. This next one may sound familiar since we've talked about it during the targeted therapy spotlight, but don't confuse them for one another in relation to immunotherapy. Monoclonal antibodies in immunotherapy are proteins that bind to specific targets on cancer cells, and they basically work to mark cancer cells so that they can be better seen by immunocytes when fighting off cancer. Immune system modulators work to enhance the body's immune response against cancer, which can or cannot possibly have a systemic reaction, meaning that it affects the whole body, or it could just affect some specific parts of the immune system. So now that we've talked a bit more in depth about immunotherapy and the more major types of immunotherapy underlying this major treatment type, and as we get closer to wrapping up today's video, let's end with talking about how immunotherapy is given and different side effects. Some of the most common methods to which immunotherapy is administered are actually the same as chemo and targeted therapy as listed in the last video. So these include through an IV, meaning through a vein, orally, meaning through one's mouth, topically, meaning that it's applied on your skin, or even intravesically, meaning via the bladder. And in regards to side effects, many do tend to occur since the immune system doesn't cause an effect only on cancer cells and acts against healthy cells and tissues too. And some of these side effects would include pain, swelling, soreness, redness, and flu-like infection, many of which could be managed still regardless. And that brings us to an end with our spotlight on immunotherapy. Thank you for joining us today for this video, and I hope it was informational and interesting for you all. Remember to play our educational game to review the information in an interactive way, and to keep an eye out for when the next video drops. Thank you all again, and I hope you have an amazing day.